insurance is to establish a rate for risk. So I'm just not exactly sure how the mechanics of this crossing state lines is going to work. Now, to directly address your issue about him having approval with 50 plans, he's probably contracted with Blue Cross of Texas, Blue Cross of New Mexico, Blue Cross of Colorado, Oklahoma, et cetera, et cetera. Typically, the insurance is based on your residency. So he will be contracted with New Mexico to cover and assist with New Mexico residents that come here for care. Same way we would go to Mayo Clinic or Denver for asthma care or whatever. Yes, it does cause him to have to be contracted with all these various things. And I think that there's probably some effective things that the National Association of Insurance Commissioners, in tandem with various state legislatures, can do to reciprocate a lot of these agreements. Now, based on my job description as being conduit and liaison between the insurer and the providers and the consumers and all this, and helping what little tax law we know, I think things like pre-certification, the confusion between what exactly is pre-certification and what is guarantee of payment, referrals. Dr. Bessler really had a very right-on comment in our panel last month, and that managed care, which started after I began in the business, has kind of come and gone. It's served its purpose. Managed care was implemented because, unfortunately, when I very first started, I remembered being very aghast at the fact that a client of mine was checked into the hospital for rest. Well, instantly you see insurers picking up the tab for things that are borderline medically necessary, and all of a sudden you have this push-pull that goes on. It's economics 101. So you have overages in one area, and then you have a squeeze play down. And now we've had a real uncomfortable, we've got so many people, both at the provider end and the insurance end, dealing with pre-cert. In my humble opinion, it's not saving one plug nickel. It's causing great grief and confusion with patients. If we eliminated that one thing, we would have a whole country full of happy campers.
Well, let's take that and jump over to Robert in that. I guess the only thing more confusing to me than insurance might be taxes. And so
that's pretty bad.
The question I have, and I think in a minute we'll get to Chris' side of this, is that is it possible to craft one solution, or is it just the nature? I mean, Texas and Oklahoma don't like each other when they play football. I mean, what are we going to do when we try to say, okay, Oklahoma, Louisiana, New Mexico, we all want to sit down and let's figure out how to come up with one way to do this. From your view of looking at the money side of this, or is it possible to come to some consensus about a one plan fits all?
What my understanding, you guys know more than I do, my understanding is that Medicare currently sort of does that, right? It establishes set prices that are the same in Oklahoma as Texas. So that's one benefit to the quote unquote public option. But even if you don't go that far, that's one benefit to getting sort of an overarching regulatory influence here, so that you can actually make the private insurance jobs quite a lot easier, because you don't have the exact problem you just described of, geez, I don't know what rates to charge somebody in New Jersey because their costs are different. They wouldn't have to be different in that sort of a setup. So I think that's why, I think that's why there's a lot of sentiment for moving away from a purely free market system, which we don't have actually because of Medicare and Medicaid and whatnot.
That's the flip side of the coin.
Yeah. But the idea that we could address this solely through the free market alone, without any.
Can I chirp in here, because that's the whole problem. Is we've already tried the government involvement, and that has got us to the edge of bankruptcy. And that's what the American people are asking outside of the insurance, the physician, and the health provider. The American people are saying, okay, we've been told Medicare, Medicaid is going to bankrupt, but now they want to take over the whole system. And so what is the incentive? Most people at the end of this week are asking one question. Are my premiums going to be lower after this health plan is initiated, whatever they decide? And
well, not everybody's asking that, though. Well, people that don't have insurance have a totally different question.
And we've had a sliding scale on that, because we started the debate at the beginning with 49 million people uninsured in this country. We've now had a reality check, and it's down to 30. And I'm sure if you went out and asked some people that are choosing not to have health insurance, either because they're young or they just choose to take their own private pay route, there is probably a more realistic number, which is totally uninsurable or cannot pay for insurance, is probably a lot smaller number than the debate. But I want to tell you this is out in talking to people in the heartland. People are asking the question. The government, our federal representatives, had the best access to health care in this country at a very low cost. Why is it that in this debate, the only information they truly knew was the health plan they had access to? And yet, we are not, as American citizens, going to be given that kind of health plan. We are going in, when you read the 1,990 pages, it is a labyrinth, a complex scenario that doesn't even look like what each congressman or senator has access to.
So do you think that the idea then of saying one of the things that we want to do is put our leadership under the same kind of plans that we have to deal with every day, so that when Randy Naugabai
the total reverse, actually, it is, why don't they offer all of us the wonderful full plan that they have access to, which has over 50 insurance choices.
It's private market.
And it's a wonderful system because it works. Our own congressman is certainly the beneficiary of that, but everyone in the federal program is. I'm not saying that's a solution. I'm saying it's a little disingenuous to present 1,990 pages of whatever has been massaged into what is now called America, America Health Care
Well, would you say that on both sides of the political spectrum, as you see the common person, that is there a sense that that's one of the things we'd all like to see as citizens, is that our leaderships get in the boat with us?
Well, let me tell you, I've heard Mark and you guys talk, and I would rather have this input as opposed to the input that is going on in the vortex of the Congress right now, which is a circle of lobby and special interests. Each line item in there has a tag on it, and it's like, did I get mine in there? Right. That is so, it doesn't work together. It is going to drive the costs up, not down, which the American people are being told, we're going to cut the fat out of this, we're going to streamline. That's not going to happen with this bill that's on the table.
Let me make a point about cutting the fat, and they specifically earmark Medicare.
Exactly.
$400 billion is the number bantered around on most of the pundit talk shows that they can save with respect to fraud and abuse. Now, my involvement as a healthcare provider in terms of quote-unquote fraud and abuse is unique, because everyone hears about a certain clinic someplace that sent in simply fraudulent claims, made up names or stolen names and identities, fired in from the back of a pizza parlor that represent themselves as a cancer center, and there's a certain number of millions of dollars. You accept all of those major things that they discover every year, and it's minimal dollars minimal dollars.